There's a digestive symptom that most people over 70 dismiss as just another inconvenience of aging. Yet this seemingly minor change in your body could be signaling something far more serious than you realize. Today, I want to share crucial information that could literally save your life, because what I'm about to reveal challenges everything most people believe about normal aging and digestive health. For decades, we've been conditioned to accept that as we get older, our bodies simply don't work as well as they used to. Slower digestion, occasional discomfort, changes in appetite, these are all written off as inevitable parts of the aging process. But here's what the medical community has been reluctant to discuss openly. There's one specific digestive change that, when it appears after age 70, serves as an early warning system for potentially life-threatening conditions. The symptom I'm referring to is persistent, unexplained changes in bowel habits that last more than 2 weeks. This isn't about occasional constipation or the rare bout of digestive upset we all experience. Instead, it's about fundamental alterations in frequency, consistency, or appearance that represent a significant departure from your normal pattern. What makes this particularly insidious is that most seniors, and even some healthcare providers, attribute these changes to aging rather than investigating them as potential disease markers. Understanding why this matters requires us to examine what's really happening in your digestive system after 70. While some changes are indeed normal parts of aging, such as slightly slower gastric emptying or reduced production of digestive enzymes, dramatic shifts in bowel patterns are not. Your intestinal tract has spent 7 decades developing its own unique rhythm and characteristics. When that established pattern suddenly changes without an obvious cause like medication adjustment or dietary modification, it's your body sending you an urgent message that something deeper requires attention. The digestive tract serves as far more than just a processing center for food. It's intimately connected to your immune system, houses trillions of bacteria that influence everything from mood to inflammation levels, and acts as an early detection system for systemic diseases. When serious illnesses begin developing in your body, the digestive system often reflects these changes before symptoms appear elsewhere. This is why paying attention to persistent digestive changes after 70 isn't just about comfort, it's about survival. Consider what happens when your established bowel pattern shifts dramatically. Perhaps you've been regular your entire adult life, having one well-formed bowel movement each morning, and suddenly you're experiencing loose, frequent stools multiple times per day. Or maybe the opposite occurs. You transition from regular movements to severe constipation that doesn't respond to your usual remedies. These aren't just inconveniences requiring dietary adjustments. They're potential indicators that your body is fighting something significant. The most concerning aspect of this digestive warning sign is how it can signal colorectal cancer, which remains one of the leading causes of cancer death in people over 70. While screening guidelines often become more relaxed after this age, the disease itself doesn't become less dangerous. Persistent changes in bowel habits, particularly when accompanied by other subtle symptoms like fatigue, unexplained weight loss, or slight abdominal discomfort, can indicate tumor development long before the cancer becomes detectable through other means. But colorectal cancer isn't the only serious condition that announces itself through digestive changes. Inflammatory bowel diseases, which many people assume only affect younger individuals, can actually first manifest after age 70. These conditions create chronic inflammation throughout the digestive tract, leading to persistent diarrhea, abdominal cramping, and gradual nutritional deficiencies that compound other age-related health challenges. Equally concerning is how digestive pattern changes can signal the development of diverticulitis, a condition where small pouches in the colon become inflamed or infected. While diverticulosis, la presencia de estas bolsas sin inflamación, es relativamente común y a menudo inofensiva en los mayores. La transición a diverticulitis representa una emergencia médica que puede llevar a la perforación, formación de absceso o sepsis potencialmente mortal. The early warning signs often include subtle changes in bowel patterns weeks or months before acute symptoms develop. Perhaps most surprisingly, persistent digestive changes after 70 can indicate the early stages of neurological conditions like Parkinson's disease. The enteric nervous system, often called the second brain, controls much of our digestive function and can be affected by the same processes that damage brain cells. Constipation, in particular, can appear years before the classic motor symptoms of Parkinson's become evident. This connection between digestive health and brain function underscores why seemingly simple bowel changes deserve serious attention. Cardiovascular disease also frequently announces itself through digestive symptoms that most people overlook. Reduced blood flow to the intestines, a common consequence of atherosclerosis, can cause chronic abdominal discomfort, changes in bowel patterns, and poor nutrient absorption. These digestive symptoms often precede more obvious cardiac symptoms like chest pain or shortness of breath, making them valuable early indicators of systemic vascular disease. The challenge lies in distinguishing between normal, age-related digestive changes and those that signal serious disease. Normal aging does bring some predictable modifications to digestive function. Stomach acid production typically decreases, which can affect protein digestion and vitamin B12 absorption. Intestinal motility may slow slightly, leading to longer transit times. The beneficial bacteria in your gut microbiome may become less diverse. However, these changes occur gradually over years and rarely cause dramatic shifts in established bowel patterns. In contrast, disease-related digestive changes tend to be more pronounced, persistent, and represent clear departures from your personal baseline. They're often accompanied by constitutional symptoms like fatigue, decreased appetite, or subtle weight loss that you might attribute to normal aging, but actually indicate your body's resources are being diverted to fight illness. The key to using this digestive warning system effectively lies in developing awareness of your own baseline patterns. Después de 70, se vuelve crucial prestar atención a la frecuencia, la sincronización, la consistencia y la apariencia de sus movimientos intestinales. Note any persistent changes that last more than 2 weeks, especially if they're accompanied by other symptoms like abdominal discomfort, bloating, or changes in appetite. Document these patterns, as healthcare providers often need detailed information to distinguish between benign age-related changes and potential disease indicators. Blood in the stool, even small amounts that might be visible only on toilet paper, should never be dismissed as hemorrhoids without proper evaluation. Similarly, persistent mucus in bowel movements, significant changes in stool caliber, or the development of urgent, frequent bowel movements that disrupt sleep patterns all warrant immediate medical attention. These symptoms become particularly concerning when they represent changes from your established norm rather than long-standing issues. The color of bowel movements also provides valuable diagnostic information. Very dark, tarry stools can indicate bleeding from the upper digestive tract, while bright red blood suggests lower intestinal bleeding. Pale or clay-colored stools might indicate problems with bile production or flow, potentially signaling liver or gallbladder disease. Persistent green stools, while often benign, can sometimes indicate rapid intestinal transit or bacterial imbalances that require evaluation. Entendiendo el tiempo de los cambios digestivos proporciona pistas diagnósticas adicionales. Síntomas que ocurren consistentemente después de las comidas podrían indicar problemas con la producción de enzimas digestivas o la función de la vesícula biliar. Early morning symptoms could suggest inflammatory conditions or medication side effects. Nighttime digestive disturbances that wake you from sleep are particularly concerning, as they often indicate more serious underlying conditions than síntomas que ocurren solo durante las horas de vigilia. The relationship between digestive symptoms and other body systems becomes increasingly important after age 70. Persistent digestive problems can contribute to nutritional deficiencies that compound other health issues. Chronic diarrea puede llevar a deshidratación, desequilibrios electrolíticos y mala absorción de medicamentos. Severe constipation can worsen urinary retention, increase fall risk through straining, and contribute to cognitive confusion through toxin buildup. Medication interactions and side effects become more complex after 70, making it essential to consider how your current prescriptions might be affecting digestive function. Many medications commonly prescribed to seniors can cause constipation, including pain medications, blood pressure drugs, and antidepressants. Others, like certain antibiotics or metformin for diabetes, can cause diarrhea. However, even when medications are suspect, persistent digestive changes should still be evaluated to rule out concurrent serious conditions. The immune system changes that accompany aging also influence how digestive symptoms should be interpreted. Older adults may not develop the typical inflammatory responses that younger people experience with serious illnesses. This means that conditions like appendicitis, diverticulitis, or intestinal infections might present with subtle digestive changes rather than severe pain or high fever. What might seem like mild digestive upset could actually represent a serious condition that requires immediate treatment. Nutritional factors play an increasingly important role in digestive health after 70, but they can also mask serious underlying conditions. While fiber deficiency might explain new constipation, it's crucial to ensure that dietary modifications actually resolve symptoms before concluding that nutrition was the primary cause. Similarly, probiotic supplements might temporarily improve digestive function while masking underlying inflammatory conditions that require medical treatment. The psychological impact of persistent digestive problems shouldn't be underestimated, particularly for seniors who may already be dealing with multiple health challenges. Chronic digestive discomfort can contribute to depression, social isolation, and reduced quality of life. However, it's important not to attribute digestive changes to stress or psychological factors without first ruling out physical causes, as serious medical conditions are often misdiagnosed as psychosomatic in older adults. Social and cultural factors can also influence how digestive problems are perceived and reported. Many seniors grew up in eras when discussing bodily functions was considered inappropriate, making them less likely to seek help for digestive symptoms. Additionally, fears about medical costs, invasive procedures, or potential diagnoses might cause some people to minimize symptoms or delay seeking care. However, early detection and treatment of serious digestive conditions typically results in better outcomes and often less invasive interventions. The diagnostic process for persistent digestive changes after 70 has evolved significantly in recent years. While colonoscopy remains the gold standard for evaluating many digestive problems, newer techniques like CT colonography or fecal immunochemical testing can provide valuable information for seniors who aren't candidates for invasive procedures. Blood tests can detect markers of inflammation, infection, or nutritional deficiencies that might explain digestive symptoms. Understanding when to seek immediate medical attention versus scheduling routine follow-up is crucial for seniors experiencing digestive changes. Any sudden onset of severe abdominal pain, persistent vomiting, signs of dehydration, fever accompanying digestive symptoms, or significant rectal bleeding requires emergency evaluation. However, even gradual changes that persist for more than 2 weeks merit discussion with your healthcare provider, particularly if they represent departures from your established patterns. The good news is that many serious conditions that cause digestive changes are highly treatable when caught early. Colorectal cancer has excellent survival rates when detected in early stages. Inflammatory bowel diseases can often be managed effectively with modern medications. Incluso infecciones graves, que podrían ser letales si no se tratan típicamente, responden bien a la terapia antibiótica apropiada cuando se diagnostican a tiempo. Prevention strategies become increasingly important after 70, though they shouldn't replace vigilance for symptoms. Manteniendo una hidratación adecuada, consumiendo suficiente fibra de fuentes diversas, permaneciendo físicamente activo dentro de tus capacidades, y gestionando estrés all contribute to digestive health. Regular medication reviews with your healthcare provider can identify drugs that might be contributing to digestive problems. However, these preventive measures work best when combined with awareness of your body's signals and prompt attention to concerning changes. The integration of digestive health monitoring into overall wellness planning represents a crucial component of successful aging. Just as you might monitor blood pressure, blood sugar, or weight regularly, paying attention to digestive patterns provides valuable information about your overall health status. Keeping a simple diary of bowel movements, noting any changes in frequency, consistency, or associated symptoms can provide your healthcare team with essential diagnostic information. Remember that your digestive system has been your faithful companion for over 7 decades. It has established patterns and rhythms that reflect your unique physiology. When those patterns change significantly and persistently, especially after age 70, your body is trying to tell you something important. Don't dismiss these changes as inevitable consequences of aging. Instead, view them as your body's early warning system, alerting you to potential problems while they're still manageable. The takeaway here isn't to become anxious about every digestive fluctuation, but rather to develop informed awareness of what represents normal variation versus cambios concernientes. Your digestive health after 70 can serve as a window into your overall well-being, providing early detection opportunities that could literally save your life. Trust your body's wisdom. If persistent digestive changes are telling you something isn't right, listen to that message and seek appropriate medical evaluation. Early detection and treatment of serious conditions almost always leads to better outcomes than waiting until problems become severe. Your digestive health deserves the same attention you give to your heart, your brain, and every other system that keeps you healthy and independent. In the end, understanding this crucial digestive warning sign empowers you to take control of your health in ways that can add not just years to your life, but quality to those years. Your body is still communicating with you after 70. Make sure you're listening to what it has to say.